Are you thinking about starting a GLP-1? Hi, I'm Coach Chris, your Regenics weight loss and performance coach, and I've worked with hundreds of men and women starting GLP-1 therapy. Some lose fat quickly, for some it may take a little more time, but every success story has two things in common. They started and they stayed consistent. Today, I'm gonna share 5 things I wish every patient knew before their first GLP-1 shot. What actually happens, what to expect, and how to set yourself up for successful weight loss and get the results you deserve. 1, the perfect time doesn't exist. There's always gonna be something in the way. A birthday, a vacation, a busy week, and in fact, this form of procrastination has a name, and it's called Start on Monday syndrome. But here's what I tell my clients at Regenics. Momentum triumphs. Consistency is crucial. You don't need to feel ready, you just need to start. Because the first injection isn't about perfection. It's about setting the tone for the next 6 months of your transformation. Once you take that first shot, the data starts. The metabolism begins to learn the new changes the medication is offering, and soon your system will shift and start to burn fat. After the first shot, you'll start learning how your body responds, what foods may trigger nausea, how your hunger shifts, and how your energy levels change. The feedback is where magic happens. 2, you will have side effects. So manage, don't panic. Now, let's be real. A good amount of people are going to experience some side effects. Approximately 40 to 70% of people on GLP-1 medications experience some side effects, and many of those experiences are mild to moderate, but they usually decrease as their bodies adapt to the medication. So have a plan, a proper expectation of what could occur, and be prepared to tackle negative effects if and as they pop up. For a significant number of people, things like some nausea, constipation, maybe some stomach discomfort, bloating, or feeling excessively full can occur, but maybe nothing at all happen. Everyone's different. Reactions can range, and in most instances, it's not directly the medication's fault, but the causes of the side effects are what the patient does with their nutrition while introducing the medication to their system in months 1, 2, or 3. At Regenics, we monitor patients closely because most side effects are manageable and temporary. A few quick tips that would be helpful to avoid any negative experiences are to keep your protein in your meals to stabilize blood sugar, stay hydrated, as dehydration makes nausea worse, and track your reactions. The goal isn't to avoid side effects, it's to understand them so you can adapt and counter anything that does pop up. And if you are working with a Regenics provider, you're not alone. We help you adjust your dose, your timing, and your nutrition in real time. And if you're not getting proper treatment and just suffering through this without any help, stay to the end of the video to find out how to get in touch with a Regenics provider so we can guide you. 3, your appetite will change. Let it guide you. One of the first things people notice on GLP-1s, food doesn't hit the same. That burger you used to crave might suddenly make you nauseous. Sweets might taste off. That's your brain and gut communication resetting. GLP-1s literally reprogram your hunger cues. So instead of forcing old habits, listen to your body. Focus on protein first, like chicken, eggs, Greek yogurt, or fish, fiber-rich foods, greens, berries, or vegetables, and avoid greasy, heavy, or sugary foods early on. Your body will thank you. And don't worry if your meals get smaller at first. That's expected. The goal is nutrient density, not caloric volume. If you want to know what foods to avoid, watch our other video, Stop eating these foods on Ozempic and Mounjaro before it's too late. 4, energy and movement will shift, so ride the wave. Most people start feeling a bit tired in the first few weeks. And again, that's your body adjusting. But here's what I tell every Regenics client. Motion creates energy. Even light walks, stretching, or short resistance training sessions can dramatically improve your results and your mindset. Start small. 10-minute walks after meals, resistance training 2 to 3 times per week once your energy rebounds, and focus on movement you enjoy, not punishment workouts. GLP-1s make fat loss easier. Movement ensures that fat loss comes from fat, not from muscle. 5, stop chasing the scale. Rather, focus on optimization. Everyone wants their number to drop fast, but the goal should be long-term success. Patients that succeed do so because they focus on health optimization, not just weight loss. At Regenics, we track more than your pounds. We look at blood work, muscle mass, inflammation markers, hormone balance, and micronutrient levels. Because fat loss is just the surface result. What matters most is what's happening inside your body. When you focus on performance, energy, and confidence, the weight loss takes care of itself. So, if you're about to start your GLP-1 journey, Don't wait. And remember this, now is the perfect time. Don't stress about side effects. Know they are manageable and have a plan to handle them if they should occur. And don't obsess over the scale. Your health is what truly matters. Start, learn, adjust, and optimize. That's the Regenics way. If you want professional guidance on your GLP-1 journey, or need blood work, or coaching, or a personalized plan, visit us at Regenics.com. And make sure to subscribe, because next week, I'm breaking down the unexpected things that happen on GLP-1s and how to fix them fast. Thanks for watching, and I'll see you in the next video.